Understanding addiction relapse, common causes and prevention. Addiction relapse occurs when someone who has previously achieved sobriety or abstinence from a substance or behavior returns to their addictive habits. Several factors contribute to addiction relapse, making it a complex and challenging phenomenon to address. One common cause of addiction relapse is triggers. Triggers are people, places, or things that remind individuals of their past substance use or addictive behavior. For example, being around old friends who still use drugs or visiting a location where someone used to engage in addictive behavior can be powerful triggers that lead to relapse. It is important for individuals in recovery to identify their triggers and develop strategies to avoid or cope with them. Another factor that can contribute to addiction relapse is stress. Stressful situations such as work pressure, relationship problems, or financial difficulties can increase the risk of relapse. Individuals may turn to their addictive behavior as a way to cope with or escape from the stress they are experiencing. Developing healthy coping mechanisms and stress management techniques is crucial for preventing relapse. Lack of support is also a significant factor in addiction relapse. Having a strong support system, including friends, family, and support groups, can provide individuals with the encouragement and accountability they need to maintain their sobriety. Without a support system in place, individuals may feel isolated and more vulnerable to relapse. Building and maintaining a support network is essential for long-term recovery. Co-occurring mental health disorders can also increase the risk of addiction relapse. Many individuals with addiction also struggle with underlying mental health issues, such as depression, anxiety, or trauma. If these mental health disorders are not properly addressed and treated, they can contribute to relapse. Integrated treatment that addresses both addiction and mental health is crucial for preventing relapse. Finally, complacency can be a dangerous factor in addiction relapse. After a period of sobriety, individuals may start to feel confident in their ability to stay clean and may let their guard down. This can lead to a sense of complacency and a belief that they no longer need to actively work on their recovery. However, addiction is a chronic condition that requires ongoing effort and commitment. Staying vigilant and continuing to engage in recovery activities is essential for preventing relapse. One of the most common causes of addiction relapse is exposure to triggers or situations that remind individuals of their past addictive behaviors. These triggers can be external, such as seeing someone using drugs, or internal, like experiencing stress, anxiety, or depression, which can lead to intense cravings for the substance or behavior. Emotional distress, including stress, loneliness, anger, or sadness, can weaken an individual's resolve to stay clean. Many people turn to their addictive substance or behavior as a way to cope with these emotions, which can result in relapse. Peer pressure and social environments that promote substance use or addictive behaviors can be significant contributors to relapse. Being surrounded by individuals who use drugs or engage in addictive behaviors can make it difficult to maintain sobriety. Some individuals may become overconfident in their ability to stay sober, leading them to believe they can use the substance or engage in the behavior in moderation. This can lead to a dangerous, slippery slope towards full relapse. A strong support system is crucial for maintaining recovery. Relapse often occurs when individuals feel isolated or lack the necessary support from friends, family, or support groups. Physical and psychological withdrawal symptoms can be extremely uncomfortable, leading some individuals to relapse in an attempt to alleviate these distressing sensations. Preventing addiction relapse involves recognizing and addressing these underlying factors. Developing coping strategies for triggers and stress, seeking professional help, and actively participating in support networks can significantly reduce the risk of relapse. Remember, addiction is a chronic condition, and relapse doesn't mean failure. It's an opportunity to learn and recommit to recovery.
Does someone you love suffer from drug addiction? Don't wait until it's too late. Call our 24/7 helpline at 1-800-570-2259. A caring addiction specialist is awaiting your call.